Hey everyone, as you know, season one of Beyond Quality is in collaboration with our friends at Rise. And quick note on a couple of upcoming conferences that I hope to I hope to see you at. So one is Rise Qualapalooza. This is coming up right around the corner, June 28th through the 30th in Frisco, Texas, at the Omni PGA Frisco Resort and Spa. Great conference, all quality focused. Obviously, Qualapalooza. Lots of focus on stars. Lots to discuss this year around Clover and the recalculation and a million other things. Also, right around the corner is in September 2nd through the 4th, is Rise West. This is a huge conference and really more broad than Qualapalooza. This is where we get into risk adjustment, quality, compliance, and beyond. Not too big, not as big as Rise National. A good amount of people to have great conversations. So it's in San Diego, and hope to see you there. Thanks. Quality improvement in healthcare. It's typically described as a framework for systematically improving care. In reality, it's an endless struggle to align policy, data, and processes with human behavior. Join the RWC team and guests from across the industry as we tackle the toughest challenges facing quality today. From culture to capital, from strategy to technology, join us as we go beyond quality. Hey everyone, welcome back to Beyond Quality. Today we're gonna explore the healthcare experience in the eyes of a member and or a patient. And we're gonna dig deep into a topic that's come to define the healthcare experience, fragmentation. As an industry, we've invested a lot, right? We've made so many improvements as an industry, trying to improve the healthcare touch points. So, when you think of provider interactions and call center improvements, care management, digital tools, right? Like so many things we've done, but many members still have experiences that are confusing and disconnected and difficult to navigate. And the question is, if healthcare organizations are improving this much and investing this much individually, why does the overall experience still feel so fragmented? Today, we're going to dig into that. We're going to explore where that disconnect happens, how it impacts trust, how it impacts outcomes, and what a coordinated experience actually looks like when organizations intentionally design for it and execute on it. I'm thrilled for our guests today, to have our guests today. So first off, we have my co-host today and our member experience consultant here at RWC, Heidi Salerno. Heidi, welcome to the show.
Awesome. Happy to be
Second,
here.
we have the CEO of the Barrel Institute, Jason Wolf. Jason, great to have you today.
Thanks, Rex.
And then finally, healthcare executive advisor from Medallia, Amber Maricini. Amber, great to see you again.
Great to be back.
Hey, can each of you take just a few moments, and talk a little bit more about who you are and the work you do, just so our listeners are more familiar with you? Heidi, can we start with you?
Sure. So, like you said, I am our member experience consultant at Wallace Consulting. Came to Rex from 15 years at Cigna, actually leading member experience, especially CAPS and HOFs is really where my heart lies. So currently working today with Medicare plans, Medicaid plans, just improving that member experience, provider experience, and strategy. So happy to be here.
And Amber.
Yeah, thanks, Rex. My name is Amber Maricini. I lead our healthcare practice at Medallia, and my work is really focused on helping organizations listen better, connect with the patients and members they serve, but ultimately action on the feedback that they're delivering to the organization across their care journey. I'm based in Reno. I'm a mom of 3 and just a proud advocate and enthusiast for enhancing trust in healthcare more broadly.
Yeah, I think we had Amber on another podcast episode last year, and I think I referred to you as a fellow trust enthusiast. Right? So
That's right. That's right.
Yeah. And Jason, how about you?
Well, I love the idea of a trust enthusiast. I know we're going to get into that a little bit today. Jason Wolf here. I guess first, I'm a husband, a dad of 2, a soccer dad as well. So as you can all imagine, sometimes you feel like you do that more than you work, but that's probably the best thing you can do. I've had the honor to start and build the Barrel Institute now over 16 years. We're a global community practice working to transform the human experience in healthcare institutions, organizations, and systems around the world. So we bring together 80,000+ people in 80+ countries in conversation around how we can transform healthcare at all touch points as human beings caring for human beings. Came out of the delivery side of care myself first, found myself on this journey, and it's been quite an amazing one to see how committed people are to transforming what healthcare can and should be in the face of a lot of the buffeting winds we have faced and continue to, both from a systems, policy, and structure standpoint. So look forward to digging into that one as well.
Yeah, I think I'm excited because the different perspectives that we have on today, I feel like we cover the most important points, right? So, Heidi with deep experience on the payer side, the health plan side. Jason, a lot of experience on the delivery side. I know you do more. We all do more than this, but Jason, deep delivery side experience, I feel like. And then Amber, this kind of voice of the customer, voice of the patient, right? Looking across all the signals and the data and to help connect it all. So I think, I'm excited about our conversation too. So Jason, let's start with you. When we think about the healthcare experience, I think most of us, kind of immediately go towards our experience as a patient in the delivery system, right? It's much bigger than that, but that's where we usually start thinking about the experience, I think. So, but from your perspective, what happens when you get outside of that system and you start, interacting with other parts of the ecosystem?
Yeah, I mean, I appreciate the question because I think it's an important one that we're still learning from the healthcare delivery lens, that experience isn't just simply in clinical boxes or physical buildings, right? In fact, more of the experience people have in healthcare in our system here in the United States and in many places reaches well beyond the boundaries of those clinical spaces. So I think to your point, I even think healthcare consumers, patients, they look at their healthcare experience as a much more integrated journey than the system tends to operationalize it, if I would say. And so I do think that we have huge opportunities, and there's clearly gaps in the way people learn about healthcare institutions and either are led there by referral, by word of mouth, or by what their insurance says they can do. It lasts well after their clinical encounter, to the stories they tell, to the problems they might have in dancing around billing situations, to the follow-up that they do or do not get from their specific care encounter. So I do think the idea of healthcare being a continuum focus and experience really being from the beginning to the end of that continuum of someone's care journey, awareness of an institution to the fact that they start talking about it to someone else is the lens that we should take in dealing with experience. I've always said, and I think probably was guilty of it in my operating days, we tend to compartmentalize healthcare operationally to survive the chaos of the system we built. That is actually counter to the needs, I think, or even the wants of the healthcare consumer traveling their health journey. So we have some work to do still in rewiring the system in a way that meets exactly the challenges I think you're asking about, Rex. And that's where I'd start. We really have to think about it from, end to end, not door to door, if that makes any sense.
Yeah. When I first started, even thinking about what to say at the beginning of this to kind of tee up the episode, in my notes I had, we're going to be looking at this from the, kind of through the eyes of a member, and then I put / patient, and then I put / beneficiary, and then I put / customer or consumer, right? Like there are so many roles I feel like a person plays as they go through this journey that complicates it, right? We're not just a customer of a retail store. In healthcare, you're a patient of this organization, a member of that organization, a beneficiary maybe to the government, and as you're picking a Medicare plan. Anyway, it's I feel like we kind of inject some identity crisis into the problem. Heidi, as that member of as a patient of the healthcare system, typically is also a member of a healthcare plan, right? They sometimes become the middleman, right, between those two fragmented organizations. Can you kind of paint that picture of what that looks like from a pain point perspective?
Yeah, absolutely. I mean, totally agree with what was said. I think one of the biggest pain points is that whether you want to say member, whether you want to say patient, they experience healthcare as one system. But a lot of times we are kind of operating as a multiple disconnected organizations. So we think about it a little bit differently. I think health plans are thinking in terms of benefits, in terms of, authorizations, networks. And then you've got the provider piece thinking about clinical care and their workflows. But when we think about the member, they truly don't, distinguish between those two different things. They just want to know, was it easy to get the care that they need? Or did we make that difficult for them? So I think when that fragmentation exists, that's where the member's kind of left to be that coordinator. So they're making multiple phone calls, they're repeating their story, they're trying to understand. They might be getting conflicting information from the plan, from their provider, or like navigating delays between information that needs to flow between providers and plans. And I also think, it's not always tied to like one big failure or one catastrophic moment. It's kind of, I think it's a lot of little things that compound. So you call in and it's like, you need to call your doctor, or the doctor says you need to call your plan. Then they go to the pharmacy and it's their medication's not covered. So those things might be small individually, but then when we collectively bring that all together, that's where they're starting to lose trust, I think, in the entire system. And we underestimate how much that impacts perception. So you're looking at a physician, they might have an excellent physician, but if their prior authorization's delayed, their benefits are confusing, that starts to even spill over into their provider relationship. And then I think the reverse is true too, right? Like poor provider communication, that impacts their perception of the health plan. So from their perspective, I don't think there's a payer experience and a provider experience. It's their healthcare experience, their human experience. And I think that's where we still have some work to do there.
Yeah. Organizations that are the payer and the provider both, they have it figured out, right? There are no pain points there. So we should just all be fully integrated, right?
Would be
I'm
nice.
joking, but yeah. No,
I
it's
got the joke.
yeah. You would think, right? Like there should be an advantage there, but there's not always. I know it's not that easy. Amber, from a listening and insights perspective, what does the fragmentation data look like? What does it look like in the data?
Yeah, this is just another opportunity to just really commend the work that the Barrel Institute has led and set the foundation for the industry. Is they have a model where we're looking at a patient, consumer, and then ultimately the human experience. And so how do we continue to elevate and make more meaningful the work that is happening within these individual boxes, but also keeping an elevated view at the overall human experience level, right? And the big piece when we're talking about fragmentation from a data perspective is you really need both views, right? We do need the ability to concentrate and get focused and targeted on how to improve those different channels or interactions, but we also need to be making sure that we're framing data at an overarching perspective so that we can ensure that it all cascades and aligns down from the human experience that we're trying to drive. So on the member perspective, we might have a good call center interaction, right? A patient might have a good provider visit. So Jason's talking about the door-to-door. The portal itself might technically be working, but when we think about connecting those moments, that's when we start to see where the confusion, the repetition, the delays exist on the overall human experience and aspects of the journey. So in the data, when we're talking about how do we identify these moments, you'll often see it in terms of comments, right? So when we think about I had to repeat myself, or I was bounced around, or it was incredibly frustrating. And this is why Medallia really focuses around the unstructured feedback, because scores can tell us one thing, but they're not going to tell us how to fix it or why it mattered to the human aspect of the experience. And if we're trying to drive and keep anchored on improving the human experience and not just the moment of patient experience or communication between the provider and patient directly, we have to think about the data more holistically and centering it back around the human ways that we can capture voice. And just one other note here, it's not just important in how we're capturing that for the humans that we serve in the industry, but also the humans who are serving other humans. And being able to integrate learnings, because on the employee side, on the caregiver side, on the contact center agent side, they're also experiencing a lot of friction, right? A lot of frustration, a lot of burnout that tends to be anchored on the experiences they're delivering to those humans in the first place. So thinking across the journey from our data points holistically for those that we serve, but also for those who are serving, is really important when unifying the data story.
Totally agree, Amber. I mean, honestly, just your guys' ability to take the voice of the member, that unstructured feedback, like when you are mapping out those member journeys, I feel like that gives so much context that surveys alone, you just don't capture that. And, that's where a lot of like the low hanging fruit comes out of, because you're not aware until you have that. But okay, speaking of the member journey, Jason, I'm curious from your perspective on this. Do you think that healthcare systems today are truly designed around member journeys, or are they still largely built around the way organizations internally operate?
I always thought a bad podcast answer was no, but that's the answer. I mean, you know, I think picking up on what Amber was saying, I mean, I think, we define experience through the Institute lens as the sum of all interactions that people have based on organization culture that influence patient, family, caregiver perspective across the continuum of care. And I think to Amber's point, really the human experience is that at its core with the workforce experience that Amber said is so important. And then the community experience in which our health systems operate. And all those things need to be connected. And I would say that none of us would disagree. The experience of someone traveling through their own personal healthcare journey is unfortunately a disconnected one. And we've created gaps because we've built a system with seams. And the question that I continue to scratch my head about, and I think organizations do as well, is that everybody knows that, but I'm not sure people are clear or engaging with one another on who's accountable to make sure people don't fall into the middle, right? And so I think back to what we've been saying, and I think every one of us has said it, right? A patient, their family member, their care partner, they're on a journey that doesn't end, right? They don't stop at the edge and kind of figure out how to get across to the next thing. They're assuming that's going to be managed for them. And so when you actually probably, and Amber could attest to this a lot of the disconnect, especially in the data that's collected, which is in stories. I think sometimes we forget actually stories are as important data as a number on a survey. Are stories about people falling in those spaces. It's not the doctor was bad, or even the, my pre-forms or getting approvals might have been frustrating, but it's all those transition points at each of those steps along the way. So I do think, to your question, I mean that we have an opportunity to figure out how to fill in those seams. I was jokingly talking to someone the other day, like the idea that whoever made that little foam piece that you stick between the washer and dryer where the socks don't go anymore. I mean, in some ways we're missing that, right? And the only way we deal with that is either with someone coming in with an insight around how to bridge those gaps, or the different components of the system actually working together to make sure that those transitions work. It's not incumbent on the consumer to figure that out, or the member, right, to figure that out. Yet, what we've done, we as a system have actually told them it is their job. Mm-hmm. And that's a problem. And I think if you begin to look at what's created issues around trust, concern around fragmentation, we could even get deeper and talk about the cost that the system carries that gets passed back to patients. Primarily happens at those points. And I do think we have a bigger opportunity, a bigger responsibility as healthcare operators out there across all pieces, right? To make sure that those gaps are filled in a way that people can see the bridges between one step to the next.
I love that analogy with the foam.
Me too.
And it makes me think, I was a consulting engagement with an integrated plan a few years ago. So, they were working closely with the health system. We were launching quality improvement initiatives, and they launched this system where they called it the buddy system, right? Where every initiative had one person from the health plan and one person from the delivery side co-own that initiative. And it still wasn't perfect, but I felt like it took us so far in improving the coordination between the two, which is such a missing piece frequently. And there aren't those buffers that are catching the things that are trying to fall between the cracks that you're talking about, Jason. And But that helped. But to your point, it wasn't. No one's created the perfect system for that yet. But there's a lot more we can do. I know. Amber, I'm curious. As you're looking at organizations and signals across capturing these stories and these pain points, what can organizations do to better identify and prevent these experience breakdowns?
Yeah. So when I think about the listening structure and the components that we're designing in a system, in order to avoid fragmentation, we need to think beyond the moments where we're collecting surveys, right? Because surveys represent touch points, those moments in care. And the broader conversation around trust and the way that we're framing really the trust crisis that has been existing in healthcare, it takes me back to the patient safety movement and the 2 errors human report. And when we were talking about communication errors, human-induced medical errors, how is the 3rd leading cause of death, right? 50% of these are happening between communication errors, with a large majority happening at handoffs. So when we think about experience moments and building trust, we really need to be thinking of those handoffs, right, in care. And it's those in between the moments between the provider and the health plan, between the digital and the human support interactions, between the scheduling and the care delivery. Those are the moments that we've identified as the critical intervention points to improve patient safety. And they're the same moments from the patient point of view where we can be improving patient trust. So when we think about the integration around data and signals and how we're bringing those together across those separate moments, it's the intersection between the survey feedback, the conversational data happening in contact center, the digital behavior, your complaints, and how do we integrate that across the journey so that you can see what is rising from a volume perspective and an impact perspective on the overall experience in the way that we're building or either breaking down trust across the journey. So data is a significant impact in the way that not only we're able to understand what is impacting the patient experience, the human experience, right, the workforce experience, but ultimately how are we driving trust? And by using words and topics that align with what we're trying to drive from a human point of view, that can help us understand where we have the greatest opportunity to action and make change across the journey.
100%. I totally agree. I feel like what's so important is being able to use that data and use it to drive that coordination. So, I mean, when we think about what coordination looks like kind of in the health plan environment, that's where I feel like the member, they don't have that feeling of that they have to manage themselves. So their experience feels connected, and we're able to identify that through the data, and the unstructured feedback that you're referencing, Amber. But I feel like, the member doesn't have to repeat their information over. They don't have to get the conflicted answers or be bounced between departments or vendors, right? I think operationally, in order to have that coordinated experience in the health plan, it requires a few things. So when I think about that, first, I think shared visibility is a big piece of that. So different parts of the organization, whether we're thinking through, customer service, care management, pharmacy, they need visibility into that same member journey and pain points. So I think being able to have that information handy where everyone can kind of access that, so important. Which, I work with so many organizations that their biggest downfall is that they're operating in silos and they're not thinking of this member journey or human journey really as one continuous journey between departments, between providers and vendors. I think second on my mind is really around kind of that closed loop process. So we talked about authorization issues, so I'm just going to go there. Referrals, pharmacy problems. I think there needs to be ownership through resolution with those members, not just a handoff, right? It's not a plan issue, it's a provider issue, or it's a pharmacy issue. There just needs to be full ownership. And I think the biggest driver of dissatisfaction, at least from what I see, is when members feel like really no one's trying to be accountable once the issue's kind of been stated. And I think third, having that information, right, that allows the experience to be, and this is where I see plans really starting to make this big shift, is it be a proactive experience, not such a reactive experience. The strongest organizations I'm working with, they're identifying that friction before the member even encounters it. So it could be a disruption in their medication access. It could be high risk transition to care, struggling to navigate benefits, but they're not waiting for those complaints to come in or a member to like raise their hand, like I'm confused or a poor survey outcome. They intervene before that ever happens. And I think last, it just, we keep hitting on it. So the alignment, right, between the health plan and the provider ecosystem. So the member, they really don't care where the breakdown happens. They just want to know that they're getting the help, and it's all hands on deck to make that possible. But I think, when a coordinated experience works well, it's almost, it's invisible to the member what's going on behind the scenes. Jason, I am curious, from a human experience perspective, what changes when coordination is done well?
You giving me all the easy questions today. No, it's just
I'm trying.
The reality with this one, no, I think it's a lot of what you touched on, right? I think when we create a coordinated system, we actually enable a patient to be a patient. We enable a family member to be a caregiver, rather than a navigator or a stressed out traveler, right? And I think there's a big difference. Think if we want to, I'm a metaphor guy, so if you think about what it's like the day you get to the airport and you can get through security and it goes well, and you get to the gate and nothing's delayed, and you get on the plane and you're comfortable and they take care of you, and you get off and your bag shows up and the car takes you where you need to go and you end up there and everything's ready for you. And it just, that level. Now, mind you, those systems aren't connected, right? And sometimes that works really well. We are actually in a system that could be that connected, and imagine what it could be like for someone then, if we really all worked with this idea of the human in the middle of the experience that was really traveling maybe one of the most vulnerable, confusing, petrifying moments in their life, right? And instead, we tell them, you have to manage the system. Mm-hmm. That is truly on us as pieces and parts of the system overall. So I think when it goes well, someone is not even thinking about this, right? Like you said, anticipated authorizations. I've already got your records. So nice to see you. It looks like these things are already taken care of and we don't even have to worry about it. We want to make sure you can get into your appointment or you can heal. We follow up with you later to know things are taken care of. Your bills don't require weeks or years of argument or embattlement over $50. Those kind of things. It does, I think, in the inverse of your question, I think oftentimes people feel like the system, which is back to the trust issue, Amber, you were touching on, is not built in the interest of the people it's serving. Right. And we're the only industry that I know that actually is like that. Whereas we have, quote unquote, consumers, yet we make them carry the burden in an uncoordinated way. So I think when we create a coordinated experience, people unfortunately might be a little surprised, but they would be joyous and they would be able to focus on, like I said from the start, their healing, their well-being, and their personal journey of what's needed for them. I think we'd have ultimately a healthier society, a safer healthcare system, better outcomes, and a lot less sick people overall.
Absolutely. Yeah, absolutely. All right. Yeah, Jason, totally agree with what you said. And I think in this conversation, like my favorite thing right now is like we are all bringing such a unique perspective, but the one thing we keep saying is human experience. And it is not a member experience. It's not a patient experience. It is a human experience. So I love that we're on the same page with that. Amber, we've talked a lot about, member experience or even human experience being truly coordinated. In your mind, like what does that look like? What does that feel like for members when it is coordinated well?
Yeah. So, Jason, it's so easy to align with your messaging. And when you talk about having an experience where the efforts are coordinated, it allows the patient to be a patient in their care. And with my background in patient safety research, the most important member of the care team is the patient because they are most informed on their history. And when they're not blocked by all the additional stresses and concerns around what's happening in their care, they're empowered to advocate, they're empowered to act, they're empowered to engage in their care. So when we talk about a coordinated experience, Heidi, what comes to mind for me is clarity and confidence. And on the member side, you're more likely to engage and be proactively engaging in the behaviors that ultimately contribute to those health outcomes, right? You're more likely to be empowered to ask questions around benefits and coverage and how to use and leverage the plan to support the care needs that you have. Health literacy is not something that we offer formally as an education or practice, but this industry is the most difficult to navigate as a consumer and human. So the vulnerable aspects of the experience are one thing, but even just as a consumer and paying member of these plans, it is difficult to ensure that you're leveraging all the benefits that are available to you. So when we think about a patient or a member, it's coordinated care is not having to repeat yourself. It's the organization knowing who you are before you call, knowing that you understand what was covered, and you're ending conversations feeling more empowered to act in the best interest of your care. So that confidence is really what creates trust. It's not the expectation of perfection in any sense, but it is the expectation of follow through. And when feedback is being shared about those experiences, these humans operating within the most vulnerable industry of the verticals that we are familiar with, they expect you to act and let them know that you are acting on the information they're sharing.
Agree. Totally agree. And just to pivot a little bit and think through, if we think through measurement, right? We think through right now, I mean, healthcare tends to measure performance, I think, so siloed. Plans measure plans, providers measure providers. And we keep hitting on a lot of the biggest pain points happen during these handoffs, these transitions. So interested on your thoughts. Do you think plans and providers should somehow be measured together in some way? Jason, I'll let you take that one first.
I know Amber saw it on this one as well, but I mean, yes. I mean, if we believe a system should operate as a system, I mean, that's the biggest misnomer, right, in U.S. healthcare is that we have a system, right? They should. I mean, there should be a level of shared accountability. I mean, I understand the need to assess and evaluate each segment of the system for how they're performing around their tasks, but I mean, the ultimate outcomes is like we said, is sort of the ease of the journey. I love what you talked about, Amber, right? Clarity, confidence, not having to repeat yourself. They know you. You're empowered to act. They fundamentally leave you with trust. There you go. There's your questions, right? That if you could ask people about their journey and every person on that step of the journey was responsible for those things being done well, imagine how different it would be. That means that what we talked about before, the gaps that existed would be the first place they would work together to fix, right? And so I would love somebody to make that call. That here in the United States is a policy decision, and there'd be a lot of pressure never to move in that direction. And there is right now, because everyone's operating in independent operating models with their own P&Ls and their own need to drive either volume or membership rate and volume of members. I mean, so the incentives right now for those pieces and parts of the system aren't aligned either. And so until those can be aligned, measuring them collectively is going to be challenging. So I think there's a piece even before on how do we begin to find the right incentives for what success looks like in our healthcare system. Use that word again, right? So that we can measure back to, I think, the really brilliant points that Amber was talking about before.
I agree.
Agreed, entirely. I mean, when we're thinking about how to understand this shared experience, we need to start thinking about it at that aggregated level, at that humanistic level. And then, of course, there's going to be ways of cascading how we can each control and bear influence. But ultimately, it shouldn't just be anchored on these scores around moments of care, but ultimately, Jason, as you mentioned, around the experiences we're trying to drive more holistically. So the trust, right, component, the confidence component, the health outcomes component, how is this relationship existing? And within healthcare, there's been a historical reliance on CAPS programs and benchmarking for those CAPS programs. There's a lot of focus on how I compare to others, but the reality is these systems, these health plans, they have nuanced populations that they serve. And so their focus and strategy should be anchored around how they're driving health in the community that they are serving. And I think back to my work within a nonprofit health system, and one of the responsibilities of a nonprofit health system is they have to have a community health improvement plan, right? And every 3 years, they're evaluating the impact on how they're driving improvements of the particular community that they serve. And that feels like such a better aligned practice. So you're having an assessment of the population you serve, the humans you serve, and then developing a plan specific to that audience. So it's less focused on what we're doing across the nation, and it's more focused on the community that you're responsible for.
100%. Yeah. And I mean, I think about the measurement. It's like that shouldn't be one giant scorecard. It just doesn't make sense. Like, everyone's striving for different things. They're incentivized on different things. I think they have different constraints, right? But there is that opportunity for more shared accountability. To your point, you guys have made excellent points there. What do you think that could realistically look like?
That's a good question. I would come back. I mean, I think to Amber, what Amber was mentioning. I mean, I think there are certain things, like if we would need to build something that talked to people about their experiential moments, right? Not, we get so granular. Amber mentioned the CAPS programs and all the deep dive stuff, which is great if you're looking for, organizational level or departmental level improvements around specific pieces. But, the journey map of a human being in our healthcare system is not something we've really captured. And so I do think, how clear was the process? Did you feel your handoffs went well? Did you have to only give your information one time on your journey? I mean, there are things, I think, if we sat in a room for an hour and brainstormed, we'd know exactly what would make sense for people to say, this is actually what a comfortable, caring journey looks like through my healthcare experience from well before I enter clinical space to well after I leave. I think that's a really interesting and intriguing exercise. If we even don't get there to say, what would those be? Because I think if someone even just said, if we were to do it, and even, Amber, maybe we need to write this paper. If we were going to have a system that did these things, these are the things that people really care about. Imagine if we could create an integrated, connected system that actually asked these things and we got them right on a consistent basis, what it could be.
Yeah. Yeah, I mean, at Barrel Elevate this year, Jason, there were so many conversations. Like if Barrel operated a health system, right, and if Barrel, and we use these fundamental principles that we're using to guide human experience and human beings caring for human beings and serving human beings, what that would shape. And when we elevate that conversation and when we talk about this, I think it starts with shared visibility. But also shared visibility is what stems for shared accountability. And a lot of when we think about the silos and data sharing, if we just elevate the way that we are I keep saying elevate, and it's probably because I keep seeing you, Jason, in the screen, but looking at the insights at a higher view. So when we bring about voice of patient, voice of member, plus operational data, plus that workforce feedback, it gives us a different view and a lens that allows us to step back a bit and bring it back to the human centricity around the conversation. So for me, it goes back to the data and how we're able to elevate the conversation by viewing really across the journey that doesn't just start and end within one particular organization. I think there's a huge opportunity within a lot of the pay-vider organizations where they're privy to, right, a lot of this. But I also have seen examples, Blue Cross Blue Shield Alabama is one example where they actually are doing a lot of work from the health plan perspective where they're investing in the education of the providers that serve within the community. And so we're starting to see a lot of this more innovative work and relationship building between health plans and provider networks. And when they're able to collaborate and learn from each other, that's where I think the magic happens. So more partnership, more shared visibility,
Totally
and more
agree.
accountability.
And I would add to your point, Amber, that is actually, I would add that is a good business model. So if you are still
Yes.
operating a payer organization from the mindset of we have to manage our dollars to hit
Yes.
certain marks, actually those actions, let's work on community education, let's work on partnership models that lead to greater outcomes. It's going to actually have those payer organizations, right,
Yeah.
probably reap greater benefits operationally and financially if they do that well. So it's not like
Absolutely.
yeah, we get stuck managing our own little pieces and we lose the chance to actually grow our capacity or our impact in the partnerships and collaborations that we create to have a better chance of achieving or exceeding our goals operationally and financially. And I think that gets missed significantly. So I think you hit on something really important there.
Yeah, there's been some great publications that have came out of the Barrel publication, the Patient Experience Journal, that talk about the ROI on patient experience. And when you start to see the intersection between not just the financial impact, but the safety impact, right? All of these measures are correlated. So when we can start removing those barriers for patient empowerment, patient engagement, you ultimately see those operational, financial, and safety type of changes that these organizations are also committed to advancing. By being able to identify one of those pillars to focus on, you can truly impact all areas from the business point of view as
100%.
well.
I think that transparency you hit on though is huge, and I think that's just a major opportunity there. Just one more thought from me, really, to get some of the health plans I'm working with thinking around this too, is I think that shared accountability, like when we think through KPIs rather than a scorecard, a shared scorecard, I think just working towards alignment on things like access to care, referral turnaround times, things like that. I think those are where we need to sit down and we need to partner and say, when we do this together, what does this look like when it's done well, and what is our goal here, and really start to map that out with our partners. I think this has been an amazing conversation. I'm so glad you guys took the time to sit down, talk through us. I know we lost Rex, but just closing thoughts here. Wanted to say, if you could change one thing about how healthcare organizations approach member or patient experience today, what would that be? And Jason, I'm going to turn that to you.
Is it just one thing? I mean, I think we said it today. I think we really did say it today. I think we have to have a lens of a lens of approaching this from an integrated approach, right? From a human experience lens, that it's about the patients we care for. It's about the people who show up to work in healthcare. It's about the communities we serve. And if we operate with that as our focal point, we'll make sure the gaps go away quickly, rather than our independent needs in a disconnected system. And so I think coming back to that is a really critical piece for people to consider in moving forward.
Yeah, I would just add that for me, it's looking beyond scores and beyond moments and thinking about more humanistic experiences. So even just the way that we frame feedback, is this positively or negatively impacting trust? Not, is this driving NPS up or down, right? And when we think about framing conversations in a way that's meaningful, not just to the humans we're serving, but also to the humans who are serving, that's critically important, because ultimately they're the ones that are looking for feedback that will drive the changes they're looking for to drive trust. So I've just seen so much great impact by connecting with providers around how the impact they're having on patient trust versus the hospital's likelihood to recommend them as a provider. And if we can, again, just start anchoring back to the human element of the industry that we serve, I think we would have such a stronger impact.
Totally agree. And Rex, I see we got you back. Curious in your thoughts there too. So we were hitting on, good,
Yeah.
perfect.
Perfect timing.
I'm
Perfect timing, yeah. Welcome.
Yeah, so sorry. Yeah, my so the wonders of technology, right? In these virtual podcasts, but my power completely went off for the whole area and was off for almost 15 minutes. So I missed a lot and don't even exactly know where we are. So yeah, no, carry on. Are we? Heidi, you please keep us going here, and I'll jump right back in.
Yeah, I think we're right to the end though, Rex. So if you want to hopefully we can get this part edited out. But if you want
Awesome.
to
Okay.
close us out, I think we've pretty much gone through all the questions. We didn't do the book. I don't know if you want to hit on your book question.
Yeah, sure. That's one of my favorite parts anyway, right? So let's this is where I get my reading list. So yeah, you guys are the experts in this space. So what's one book everyone should read? Yeah. Amber, we can start with you.
I am not just recommending this because Jason is on the call, but Return on Experience by Jason and Stacy. I genuinely think is a book for this industry that captures where healthcare needs to go. Again, it's elevating it back to that human level. And it reminds us that experience is not just about satisfaction as it was initially introduced as an industry, but it's about this integrated care experience of humans caring for and serving humans. So it feels especially relevant to this conversation and in industry.
I'm excited.
Well, that's kind of you, Amber. Now I'm blushing. But I
Jason.
appreciate that. I appreciate that. It's funny because I'm a culture guy first. I'm an old diplomat that found my way to healthcare through, being a purveyor and student of organization culture. And I like the classics in some ways. I mean, I believe everybody should read, believe it or not, Leading Change by John Cotter. I mean, I just think in a world of healthcare where we live in such static, undynamic sometimes, yet we're always changing because of the chaos. Just some of the basic fundamentals of what it means to understand that we are in a world of constant change and having a structure in which to operate, either as an individual or as an organization, is fundamental in solving all the things we talked about today and actually making choices that are better for others. And so, there's some fundamentals like that. There's great books out there right now, and I appreciate what you said, Amber. But to me, sometimes it's some of those really foundational principles that we can use to apply and how we lead as people in life and in healthcare that is really critical. So that's where
And I think
go.
for me,
Awesome. Heidi?
several years ago, I had a manager who recommended a book called The Power of Moments. And I feel like she has actually put me onto so many different books that were insightful, but that one really stood out for me, just from the member experience lens. And it's actually really relevant, I think, across industries, but particularly it resonated with me in healthcare in trying to solve some of these CAPS problems and member experience problems. But I think it kind of challenges the idea that experiences are built through big initiatives. It really goes down to those granular, more specific moments. So like where members can be confused or vulnerable, or frustrated, and show how that kind of disproportionately shapes how members or people would remember an experience in general. So I think for healthcare, like I said, I found it very relevant just because that is so emotionally charged, right? This is your health we're talking about and your care journey. So I felt like I took so many things away from that book and applied it to the way that I approach member experience.
That's great. I've read a billion books. I haven't read any of those three, so I'm excited to get those on the list. And yeah, thank you. Did you guys just as final question here? Did you guys already talk about like we will publish this episode? We'll put it on LinkedIn. We'll tag you guys and your organizations. But if people wanted to follow you or learn more about your work, did you already say kind of how people can do that? If not, can you say that really quickly? Jason, you want to go first?
Yeah, no, I'd invite people. So, the Barrel Institute, our site's thebarrelinstitute.org. I also appreciate Amber mentioned our journal. We publish an academic journal called Patient Experience Journal, which is also fully open access to read. So I hope people find a lot of resources that they can apply, whether they're members of our organization or not. And I think the one thing I'd just say is the tapestry of people that are engaged. What's exciting, and I think maybe some of the work Rex, you and Heidi are doing, I mean, we're actually seeing a big influx of payer organizations really being interested now in coming into the community around engaging in the experience conversation. So I do think it's catching fire, and we reflect a tapestry of people from patients to experienced champions and healthcare leaders to great people like Amber who are bringing really innovative solutions to the market, and you all. And, so that is who we are, a community that comes together to try to impact change in healthcare.
Love
Awesome.
that. Yeah.
There's also
Amber?
some additional regional roundtable events coming up this fall for the Barrel Institute. Hope to see some new registrants there, but
Yeah,
it's a
that'd be
great way to
great.
connect with other organizations. And I would love to connect with anyone on LinkedIn. I tend to share a lot about my personal experiences with healthcare and trying to keep the conversation human as much as possible. So would love to connect with anyone who has that shared interest.
Great. And Heidi,
Yeah, well,
just in
you can
case
go
people
through
don't know.
Rex or you can go through our website, and you can definitely find me on LinkedIn. So happy to connect.
Okay. Hey, thanks so much, you three. Really appreciate the conversation. Can't wait to go back and listen to the recording to know what all was said. So, but great perspectives and really, really, really important topics. So thanks so much for being on, and we'll talk next time.
Awesome.
Thanks,
Thanks.
everyone.
Thanks,
Awesome.
guys.
Thank you.
Thanks so
Thanks,
much.
Kevin.
Great being with you all.